Hello everyone, and today I want to talk a little bit more about the challenge that we are facing today with the pandemic COVID-19 and how in this situation we actually need more health coaches and how health coaches can really transform the health of our community and the entire world, specifically India. So, when we look at some hard data, what we've seen is 90%, according to Center of Disease Control, CDC, 90% of all COVID-19 cases and hospitalization have come from people who already had certain pre-existing conditions. These conditions were around hypertension, diabetes, smoking, obesity, cardiovascular diseases, certain lung diseases. These were the main pre-existing conditions, and 90% of people with pre-existing conditions landed up getting COVID-19. And we are still trying to collect data, but what it appears to me right now is people with pre-existing conditions took a little longer to recover from the vaccination also. So incidences of body ache, fatigue, fever took a few days to recover, and so on and so forth. So the American Journal of Lifestyle Medicine is talking that health coaching is extremely powerful in this situation, because through health coaching, through changing people's lifestyle habits from the underlying root cause and helping them to form sustainable habits, we can actually manage these lifestyle diseases better. We can delay the onset of lifestyle diseases, and we can actually sometimes even reverse these lifestyle diseases. Through the power of health coaching and behavioral science, we can also, what it says that is improve the quality of life and improve the longevity of a person with good quality of life. It's not just important to live longer, but what's also important is that while we're living longer, our quality of life should be really good. Subsequent to that, I wanted to talk a little bit more about who a health and wellness coach is and why they're really important at this particular point of time. But before I get there, let me tell you another important fact. Why is it that people struggle to change lifestyle habits? Why is it so hard to eat healthy? Why is it so hard to exercise? Why is it so hard to not take stress? Why is it so hard to have a routine and to sleep on time? Why is it so hard to discover a sense of purpose and meaning in life? The reason for that, my dear friends, is because we are hardwired to think we've hardwired ourselves to think and behave in a particular manner. All our habits that we have today are something that we've cultivated in the last 5, 10, 15, maybe even 20 years. We've conditioned ourselves to think in a certain way. We've conditioned ourselves to behave and act in a certain way. So hence, to change people's life and their lifestyle habits, we have to change their behaviors. And where are these behaviors originating from? Are these from our circumstances? Are these from our what we've learned at school? A lot of people think it's external to me, and actually it is not. It is internal to us. All these habits are originating from our brain. The brain has lots of millions and billions of neurons that are constantly communicating with each other, and they form synapses as they do that. As they form synapses, they create a pathway. Now these pathways, over a period of time, become more and more rigid. And as they become more and more rigid, it becomes difficult to break those pathways. And that is why changing habits is so hard. So how can we change habits without changing our mindset and changing our behavior and changing how our neurons function in our brain? And that is why behavioral science and behavioral psychology has become extremely popular. There has been a great evidence around health coaching and the impact of that with health outcomes. Okay? Therefore, a health and wellness coaching truly is a behavior change agent. He understands the behavioral science, he understands integrative health principles. That means looking at somebody from a whole person perspective, not only just looking at their physical body, but also looking at the emotional, mental, social, intellectual space, environmental space, the internal and external environment. They're trained on motivational psychology, because truth be told, most people don't exercise or don't eat because they're not motivated enough. And the motivation has to come from inside, not from external influences such as looking at a beautiful model image in a magazine. They're trained on adult learning theories. How do adults really learn? They're trained on integrative nutrition, looking at nutrition from the mind, body space. Because fact to be told, a lot of people struggle to lose weight not because they don't know what is good or what is bad for them. It's because they're not able to carry forward the good habits, or even get started. Even if they get started, they fall off the wagon. Or maybe there is an underlying different reason for them to being overweight. Stress, trauma, poor body image, whatever you may call it. So they're trained on evidence-based nutrition, exercise physiology, mind body balances, and hence a health and wellness coach can truly bridge the gap between an expert, which is a doctor, and the client. Right? We know in COVID-19 right now, doctors are significantly overburdened. They put themselves at risk, they're putting their families at risk, and they're working non-stop. There is never in the history have we had doctors and the medical fraternity as overburdened as we've had today. And they were already overburdened before. Right? The only way to reduce the burden is when we all as citizens of the country can live longer, healthier, and don't land up in the hospital. All right. So who have we seen in the past few years in becoming health and wellness coaches? We've seen doctors. They were the early people who came on board and started following, becoming coaches, or started to adopt a coaching approach, because they said, okay, my client is coming to me, they don't really want to battle diabetes. They're just pre-diabetes right now, but they need to change certain lifestyle habits. They need to manage their stress better. They need to quit smoking, I just don't know how to motivate them to do that. So with a lot of doctors earlier, we had gynecologists, we had GPs, general physicians, we had alternative medicine doctors such as Ayurveda, Unani, homeopathy, and naturopathy, because they said they had such wealth of knowledge in healing modalities, but when it came to implementing whatever they were recommending, there was a challenge. Similarly, we had nutritionists who said, okay, I understand nutrition really well, but I see my clients struggle. I tell them, I give them a diet chart, but the follow through is not there. They follow through for 7 days and they don't follow through. Sometimes they don't know what the root cause of the problem is, or that's not really evaluated. Okay, where they're not trained on how to connect deeply with clients. So we saw nutritionists and psychologists who had knowledge of mental health and psychology, but said, hey, listen, I really can contribute my skills towards helping somebody change their health and their overall well-being. We had sports coaches, we had HR professionals who were coming on board, and he said, I see lack of engagement in my employee welfare programs, and I want to improve the engagement and make it highly personalized to that individual who's going through that program. And lately we've seen a lot of young people, 22-year-olds, graduates, health, wellness, fitness enthusiasts. We've seen engineers quit their jobs, accountants quit their jobs. We're seeing lawyers coming into this profession. So it's not necessary for somebody to come from a science background to come into this profession. So you can come from any background, okay, as long as you have a graduate in any discipline, and you showcase an aptitude of a master's level certificate. You have to have that kind of aptitude and passion for sure. So we've seen accountants, we're seeing HR professionals, we're seeing mothers who are coming into the program. We're seeing people who've done their entire life. They're 50, 55, and they're saying, you know what, I've done that. I want something that has meaning. I want something that I can contribute and still create a lifestyle for myself. I want something that I can work from home and I can have my clients and I have the work-life balance and I'm able to take care of my health while earning good money, right? So people from all backgrounds, and the more coaches that we have, if every coach can, I think, make an impactful difference to hundreds and thousands of people, you can imagine what is going to happen to the health of the country. our health report card is not going to be what it is. We're not going to be the world's diabetes capital. Okay, so as health coaches, we can transform the health of our families, we can transform our own personal health, we can transform the health of our neighborhood, we can transform the health of our community, we can transform the health of our city, we can transform the health of our state, our territories, and the entire country. Today, there are so many health platforms that are looking for health coaches and they can't find as many. America has over 100,000 coaches. We only have a few 100,000 coaches in the country today. We need more people like yourself who are passionate about helping other people to join this wave of profound professional, noble profession to create an instrumental difference to the health report card and well-being of our nation. Thank you so much for listening. I'll see you again.